Okay, it's recording now. Don't say anything bad about me till after the recording's over. Okay, well, why don't we go ahead? The purpose of today's session is merely to review operational plans that you guys have created either in the system or in a template. And if you create it in a template, I'm going to give you control to go in and actually enter it into the system, and we'll walk you through the process. Some people learn really well that way. But why don't we go ahead, Min, and start with the strategic plan that you've entered in there. Just kind of walk through it a little bit and take a look at it. So what I did is I generated the operational plan for the strategic plan here. And yeah, if you go down to the bottom, you'll see where there's some activities down here at the bottom level. But for the most part, it stops at the objective level. And everything, the structure looks really good. You got the prevent up here, and then identify and allocate resources to effectively address chronic acute infectious disease morbidity and mortality. Your first goal is to improve chronic disease health outcomes through the integration of evidence-based programs and policies. And then your first objective, reduce hypertension mortality rate by 10%. The only thing, again, I would think I would add is when do you intend to, 10% could be over 20 years or it could be over the next year. So putting in some kind of a time frame by the end of 2024, reduce hypertension mortality rates by 10%, something like that. And that's all common throughout the objectives. Now, then when you get down to the activities are going to be the steps that you're actually going to go through that you think will get us to that 10%. So, what are you going to do actually that's going to get you there other than just hope and pray that it gets there?
Mm-hmm. So the goal is to provide resources through our community health workers. Two is to increase our program such as total wellness that targets specifically hypertension and cardiovascular disease.
Okay.
So increase those classes at specific quadrants strategically on target zip codes and high need areas.
Okay. So those would be the activities that you put in there, and a timeline in there, and how much you're going to, how many classes you're going to do, or whatever it happens to be.
Absolutely. So, with the timeline, this is something I need to discuss with our EPI team, especially with our data evaluator, to see what is a realistic timeline to hit this target goal by 10%, whether it is an annual timeline or target goal, or it's going to be a 4-year or 3-year goal. Absolutely. So those are the data I don't have yet until I can actually pinpoint that data.
And once you get that in there, you can put it in. And by the way, it can change over time too. Hey, we're not going to do it this year because something happened, so we're going to move it to next year. And then you're going to monitor that particular reduction, that mortality rate reduction over the period of time. And then the activities, when you put the timeline in the activities, because there's steps to get there, the timeline ought to match, on the activities. So we're going to do A, and then we're going to do B, then we're going to do C. So the A timeline is like today, and the C timeline ends, at the end of the objective, something like that.
So to measure this against something, we need a baseline, correct, Fred?
Yeah, in order to measure it, you're going to need to know where you are today, right? And it's probably, by the way, a good thing to put in the either in a note in the objective or in the objective itself. Reduce hypertension mortality from 20% to 10% or something like that.
Gotcha.
At least gives people an idea. And then you can actually go down and change the, let's go back into the plan itself here. So we're on initiative 1. Oops, let's get to the right group here. Goal 1, objective, reduce the hypertension mortality rate. So what you're going to want to do down here is put in, oops, if I get my fingers on the keyboard right, and I don't hit the caps lock. And call that a percent. So now what you're actually going to be entering down here is the current mortality rate.
Gotcha.
And then in here, we're going to put in, we'll go ahead and put you in there for now, just for kicks, as the objective lead. So yeah, so this might say reduce hypertension mortality rate. Something like that. I don't know what the real numbers are in there, but I just something along that line. And then your activities are going to be what steps are you going to go through to get there. And that's all the stuff you were talking about. But other than that, the plan structure looks really good. Again, objectives should be time-based, just so you know that otherwise, 10% could be 10 years from now, and that's not really telling you anything.
Where's the activity tab where I can add that in where it's specifically measuring based on those parameters that we set? Okay, activities, gotcha. I didn't see that one.
Yeah, these are the activities for that objective. So we've got this objective selected. You hit the activities, you're going to add the activities, and it could be that you're going to do 20 classes or whatever it happens to be. So pick the type of activity. And when you get down to that point, if you have any questions on it, feel free to just email me and say, would you take a look at this for me? And I'll be happy to help you out.
Absolutely. Sounds good, Fred. Thank you.
Okay. Did anybody else have time to either put a plan on a template or on a piece of paper or on the back of a napkin at the bar or kind of any place else? And because I don't see anything that's been entered into the system specifically in the training group here.
Fred, I just did a little bit on a piece of paper, and I'm trying to, while you're talking, trying to figure out how to put it into the dashboard. But I just did 2 of them. One was for clinical services and one was for the C1 group that I had. So for the one for clinical services, I had put that the goal was to decrease our family planning no-show rate. Our SMART objective, I put decrease family planning no-show rate by 50% by December 31st, 2024. I would be the objective lead and the activity lead as well. For activities, I put, currently figuring out what our no-show rate is.
What group is this under, Dorette?
Clinical Services Division, CSD number.
Oh, there we go. Okay. Oh, there we go. Clinical Services, goals, decrease FP no-show rate. That's good. Decrease FP no-show rate by 50% by December 31st, 24. That's awesome. Then you're going to assign somebody as the objective lead in there.
Correct. And then I was working on activities. So that's the.
What do you think about for the activities? What kind of things are you going to do to reduce the no-show rate?
One, I need to figure out through charts or get data to figure out what our current no-show rate is for the past year. Also to decrease it, call the probable no-show rate clients 3 days early. And probable no-show rate clients to text message 1 day early about their appointment to see if that's effective in decreasing no-show rate. And then our performance metrics would be pretty much that no-show rate graph that I can pull maybe from both W and the chart.
Yeah, that's great. What you might want to do, like we talked with Min, is actually in the objective, once you get the baseline in there, reduce it from X to Y, something along that line. So you got a little bit more data in there to work with. But your plan structure looks great. And again, once you get down to the activities, the idea in the activities to say, if I do these steps in the activities, will I decrease my no-show rate by 50%? That make sense?
Yes.
Okay. What? Do me a favor when you go through. That's great, by the way. Your structure is perfect. Once you get down to get some of those activities in there, just pop me an email and just tell me, the group, what it is, and let me take a look at it. That'd be okay?
Yes, 100. Yes.
Okay. Well, thank
Sorry,
you.
I'm not sure if you hear me okay. Sorry.
No. Nice job. You got the structure right. That's all we're looking for here is, do you understand the structure of the plan? And you do perfectly. I mean, everything is just exactly as it should be in there. And then again, the activities are going to be in this kind of the same time frame as the objective. I'm going to do this, this, and this, and it's going to get me to that point.
Got it.
Okay. Who else? Who can step up here?
I will step up.
All right.
So I took your advice. I did just a random one.
Okay.
My goal is to purchase a car.
I like it. Make it a test.
So Do what?
Make it a Tesla.
Yeah, right. So goals, purchase a car. My SMART objectives is to purchase a car by March 15th, 2024.
Okay.
It's going to sign it to myself. Activities, research reliable, affordable cars. Second activity was contact bank for loan approval. And my third activity was locate dealership to purchase car.
Those are great. Those are great.
So my performance metrics are, of course, they're going to be yes, no. Made myself activity leads, and then my target dates for first activity was February 1st, second was February 15th, and the third is March 1st.
That's perfect. That's exactly what you want to do. And good luck in getting that.
My fiance actually does have a Tesla, so I've only driven it once.
Which one does he have?
What is it? The 3? Model 3?
The Model 3 probably is the most common one.
Yeah.
Yeah, I've had, I'm on my 5th Tesla. I love them.
They're nice.
Yeah, I've got the one, Model S Plaid, which is the fastest accelerating production car ever made.
Mm-hmm.
And it gives me a whiplash every time I drive it. But, it's kind of fun. So. Thank you. That was exactly, your structure is perfect on that, Matt. That's exactly what you want to do. So think about that as you're doing the plans. Your goal is exactly that high level definition, purchase a car. Then your objectives are a specific time frame, purchase the ideal car or something like that in the specific time frame, and then the steps you're going to go through that you're going to get to exactly that objective. So perfect. Excellent job. Thank you.
Mm-hmm.
Anybody else?
Fred, I've got I'm with support services, and so we've been kind of working on inventory for the agency assets. So the group that I'm working with is the maintenance and facilities group, and our goal is to complete inventory of all agency assets by the end of 2024.
Okay, that sounds more like an objective.
What's that?
That sounds more like an objective because you have a timeline in there and you're very specific. So the goal might
Okay,
be.
so then really all I want, so what the pie in the sky, or what I would like, the goal is to complete an inventory assets for the agency.
Yeah, that's a great goal right there. You got
Okay.
enough in it, and then you're going to break it down to probably the different types of assets and things like that at the objective level.
Right. And then, the activities are to barcode all of the items.
Great.
And these barcodes will be identifiers that will be stored in a database to track our items. And then we would like to make it available to our leadership group so that they're able to identify all of our assets and their locations, all that information of where these assets are, type situation.
Yeah, that's exactly right. You got it all right. I mean, you start breaking it down at the goal level to be a little bit generic, and then break it down at the objective level to be very specific with your timeline in it. And you might have different timelines for the different classes of assets and things. But then the steps you're going to go through with the barcoding, enter the barcode data in the database, provide access to the database through to senior management or whatever it is.
Yeah. And I think maybe having all of the assets barcoded by the end of the year might be a little too much to try and take on. So I would probably break it down into maybe facilities, as far as maybe like our north and south location, finished by June 1, and then breaking down further with our west and Sequoia location, maybe by the end of the year, something that's more achievable.
Yeah, so that would be the breakdown in the objectives.
Yeah,
Each objective, and having a different timelines for them to spread it out a little farther. And by the way, as you go forward and you realize, the barcode system's not working the way we thought it would, we're gonna have to move it back by a month or whatever it happens to be. So those are the kind of things that, will get in your way, and you can adjust those dates as you're moving forward. So your plan is always up to date.
yeah. Okay.
Excellent. That's a great example, by the way. That's a great example.
So then my target dates, I guess, are the ones that I would adjust.
Yeah, you're going to have the target date and the objective, objectives.
Yeah.
We have several different objectives with target dates. And then the activities, the steps you're going to go through, again, the dates on the activity should, the first activity should start today or whatever, and the last activity should end at the same date that your objective was ending.
Okay. Okay.
Because that kind of makes sense if you think about it. You're going through steps in a timeline, and by the time you finish that last step, that should complete your objective.
Right. Okay. Okay.
Excellent. Thank you so much.
You bet.
Kate, did you have anything?
I was just gonna say that the format fits along with a lot of the work plans that I'm working with, especially for one of our grants. And so, like one of our activities is to increase and maintain a diverse workforce. And so then we've got, or I guess that's the goal. And then we've got 7 different activities with who's responsible and due dates and how we're measuring the success. And so, for example, the first one is to research best practices in job description creation and review industry standards. And that's due by June 1st of this year. And then for the output, it's going to be a list of best practice resources being produced. And so that's kind of how all of our work plans are structured. And so it fits really easily into the dashboard.
Yeah, it sounds like kind of maybe under your workforce development plan a little bit under that group, you could build that, or build it anywhere you want to. But yeah, that sounds like the right process here.
So the thing that I'm kind of struggling with is figuring out as an agency, and this is probably more of an internal conversation, because there is so much overlap between what all the programs are doing and what's in the strategic plan. And so if we should put our activities under the strategic plan, if we should all have separate plans, how exactly we want to, work at as an agency.
Yeah, a couple things you can do. You can build a separate plan that talks about exactly what you were talking about. And maybe that's not really part of the strategic plan. The strategic plan might be at a higher level than that. And then once we get some of these plans in there, we go back through what we call 3-dimensional planning, where we can tie the strategic plan to these other plans. So you've got a direct link from the strategic plan down to the plans that, if you will, feed up into the strategic plan.
Fun. That sounds great.
Yeah,
That's kind of what the point I think I was missing.
Yeah, the strategic plan should be at a pretty high level. And everything you do in the department should be able to roll up into the strategic plan. And that's where the 3-dimensional planning comes in. We'll go in and tag, let's say it's strategic priority number 1 in your strategic plan can be tagged to this plan you were talking about down there. So you always have that linkage in there, but the plans in the system are separate, but they're tied together through this 3-dimensional. And again, that's something we go through after you've entered some of the plans in the system, because it will make a whole lot more sense than trying to go in now and put it into where there's no plan elements in there right now.
That sounds good, and that's helpful for me.
Okay. And again, as you're going through and trying to figure this out, feel free to send me what you have, and I'll help you to get it started, get it structured in there, and then once you guys get some of the plans in there and get them kind of the way you want them, we'll go back and do the 3-dimensional planning, which is only about a 30-minute session, but it'll talk about how to tie all this stuff together.
That sounds good, Fred. So I'm guessing the next step is once we get used to the format and inputting the plan is setting up training 4, which is
Yep.
the overview of the 3-dimensional.
Well, no, the training 4 is the performance monitoring. Yeah, we'll do that, and that'll give you time. So let's set up the performance anytime. Maybe next week if you guys can get it together, whenever you want to do it. It's about a 45-minute to an hour training. Talks about all the charts and graphs, the dashboard, VMSG public, and all the reporting. So you want to know all that, and then after you get some of your plans in there, then we'll go into 3-dimensional planning. Typically, just to give you a timeline, the performance monitoring can come at any time. You guys are all ready for that. The 3-dimensional planning typically is like a month after that because of getting the plans in there and understanding how to get them in there, and then we'll look at it and talk about, okay, this piece of this plan ought to be related back to this portion of the strategic plan. It'll make a lot of sense once we do it, I'm sure.
Absolutely, that sounds good. Absolutely.
Okay.
So go ahead, Fred. I apologize for that.
I was going to say, just find some times that you guys are available for about an hour in the next couple of weeks, and we'll do the performance monitoring training. And then, like I say, maybe 3 weeks or a month after that, you guys will have the time to get some of your plans in there. Then we'll go back and do the 3-dimensional planning.
That sounds good, Fred. Is there any additional pieces of information we need for training number 3 besides what we just went through with you?
No, this is what I wanted to go through with everybody to kind of take a shot at creating a plan. And by the way, the plans that you guys all talked about, if you want to put them in the system and practice doing that, go to the little training group down here and build your plan, starting at a service. And if you do that, put your initials in after the service, just so we know who did it. And then just kind of walk yourself through and put the plan in there. It's a learning experience, just figuring out all the buttons to push and how I assign the people to the activities and the objectives and all that. So if you get time to do that, and if you do it, just pop me an email. I'll take a look at it for you. Okay.
All right, that sounds good, friend.
Well, thank you so much for your time today, and good job, everybody. Everybody's plans. You got the right mindset. And that's what we're trying to get here is the planning mindset in there at the different levels, and you've all got it nailed down. So that's great. Thank you, everybody.
Well, I appreciate your time, Fred. I'll be in touch. I'll try to work with the team again to get training number 4 scheduled. Like always, once we get that verification, everyone's availability, I'll shoot you an email with your availability, and then we'll go from there.
We'll get it worked out.
I appreciate your time.
Thanks, man.
Thanks, Fred.
Bye-bye.
Thank you, everyone.
Thanks, Fred.